Coming in, starting today, updated COVID vaccines are now available.
The new shots come as COVID cases and hospitalizations are increasing and the respiratory virus season is picking up. The latest data from the CDC shows more than 20,000 hospital admissions for COVID in the first week of September. That is up 7.7% from the previous week. For the first time, vaccines for all three of the major respiratory viruses, COVID, flu, and RSV, are available this fall.
Not only will it save you time, but it takes 2 weeks for the vaccines to start working. So you'll be fully covered by the time the season really hits.
Updated COVID shots will be covered for most people through private insurance. But if you're uninsured or you can't afford one, you can get the latest vaccine free of charge under the new federal Bridge Access program that starts in October.
The boosters, the ones that are out today, are strongly recommended for people who are at high risk.
So what are the latest guidelines? UW Health's Dr. Bill Hartman is back with us again. Bill, good to see you in the studio
Dr.
again.
Hartman,
Thank you.
good to see you.
Are we seeing an uptick in COVID around Dane County?
We're seeing an uptick of COVID everywhere. There's cases, anecdotally, everyone knows people that are surrounding them right now that have COVID, and it's something that we're seeing in our community at a very high level.
What is the dominant strain that's going on
The dominant
right now?
strain right now is EG5, which is an Omicron subvariant. Will it be competed out by other strains? It remains to be seen. It's been pretty strong for a little bit yet. The symptoms that it's causing, mostly a sore throat followed by nasal congestion, so it's a milder form of COVID than what we've seen in the past, but still something that we want to be protected against.
And this new vaccine will cover that. Who should get the new vaccine?
So the vaccine is approved for everyone 6 months and older, but I think we have to prioritize the people that need it the most. So the elderly people that are living in nursing homes, and people who are immune compromised. And so people who can't fight off the infection as well on their own. And so I think that these people, it's really a priority for. Everyone else is probably a good idea for.
A lot of people, 75% of people, according to the CDC, did not get the last bivalent booster. So do you have to do these in order, or if you want to be protected now, you can get this booster right now?
No, you can get this booster right now. The bivalent booster, I believe, has been stopped in production, and the only one that you can get is the new monovalent one versus one of the Omicron subvariants. And so even if you haven't had a shot since the initial series, you'll be fine to get this one.
And it's best to pair it with the flu shot, perhaps?
I think so. Right now, the RSV vaccine, the flu vaccine, and the COVID vaccine are all available. You can get all three together, but probably get the flu and the COVID together, and then a couple weeks later, go ahead and get the RSV one.
If you have COVID tests at home that you have from the last round of this, do they still work, and are they still accurate?
We hope that they're still accurate. The FDA is actually looking at these tests right now to see whether or not they can extend the active dates on them. But if they are expired, your best bet, if you really want to know whether or not you have COVID, is to get a new test from your Walgreens.
The new test will detect the new variant that's going around?
It'll still detect COVID. It goes to a certain epitope on the virus itself, so it'll detect COVID. It doesn't necessarily tell you which variant you have.
Yeah.
All right, time to roll up the sleeves again.
There we go.
Time of year. Doctor, thanks for being with us today.
Thank you.
Good to see you, Dr. Hartman. Thanks so much.
Thanks.